We are ready to rock and roll here. Today we're going to be talking about one of the most common questions that you get asked and topics that people bring up in the consultations that we do with people, and that is the difference between red light therapy and CoolSculpting, or cryo, basically. I'm not sure. Hopefully, we can walk through the differences and similarities between even those. But in general, like I said, that's one of the most common questions and that we get. People have either done it in the past and are coming in because of issues that they've faced with that, or they've been to consultations or are considering it.
Sure. This industry, I think, is flooded with lots of different choices and avenues for non-invasive body contouring. People are more and more looking into a more non-invasive approach for sure.
And I think some of that is marketing, right? Really great marketing. So they oversimplify some of these procedures. They overpromise. People walk in really not totally understanding the risks, what it looks like, the benefits, what it can do, and more importantly, what it cannot do. So what is CoolSculpting? Let's start with that first, and then I want to go into cryo and then compare all of that with red light.
Great. So CoolSculpting is an FDA-approved way to create fat cell death, otherwise known as cryolipolysis. So fat cell death by actually freezing and crystallizing the cells in targeted areas.
Okay, so the extreme cold triggers something in the fat cell called apoptosis, which is basically programmed cell death. So the cell dies and then the body clears that through the same mechanisms that it clears it when we're doing red light therapy, which is lymphatic drainage and
That's right.
Excretion through the body.
That's right.
So what does that functionally look like? I mean, sounds
Right. Sounds great, right?
painful.
It is actually. So the differences between the two is that it is painful. It's painful. It can cause numbness. It can cause swelling to the targeted area for sure. You are using an applicator that it acts as a vacuum and a suction to pull away those fat cells to start that crystallizing process.
And I guess walk me through what that really means. Like, how long does that take? And
So, right.
What are is it permanent? Is it not permanent?
So it is permanent, right? And I do say that loosely. So let's walk through it. So right away, I'll start talking about one of the risks that are involved with CoolSculpting that we're not seeing with red light therapy is because of that whole suction, that whole applicator. What happens is in some cases we have something going on called paradoxical adipose hyperplasia, and what happens is instead of those fat cells getting destroyed, it actually causes them to increase in size, and because then they're crystallized and the body is having a difficult time lymphatically trying to let go of those things, it's what we can call brick syndrome. And what happens is you'll get a hardened area that looks swollen, and that can be rather permanent. However, what's been really incredible is that I have gotten to personally see these cases in the office where we have actually used red light therapy then to try to further break down the cell so it can lymphatically drain through the body. And we've been really actually it's been great to see the results. We've been super successful with that too. So you do run the risk of that, and more cases have been coming up in recent years. I don't know if it's more and more cases or more people are becoming more forward about having had that experience. So,
or just realizing that there's another way of addressing
that concern, because when people would have that, it's HA, it's a PA. Wait, what is it? PAH is the short. I can't do it like that. PAH. It would only be able to be taken care of surgically in the past, or even people trying to utilize liposuction to take care of that too. So this is a great conversation too, because when you ask me, is this permanent? If we are causing cell death, right, and we are destroying the cell, we're getting rid of the cell completely, we're trying to get it to move through the body. One of the other things I have seen outside of that, paradoxical adipose hyperplasia, is actually people developing increased volume in their fat cells around their treated area. Okay, so I've had people come in who have had their stomach treated, or maybe they have had their thighs treated, or they have had, just outside of the adductor treated, things like that. And what happens is if they have an experience where their body needs to actually absorb toxicity, and let's get that straight. What are your fat cells there to do? Your fat cells, by design, are created to absorb toxic material. Things that our body deems as harmful to us, our body's going to actually absorb into the fat cell. So when you have an experience of needing to absorb things into the fat cell, and you haven't made any changes, and you've gone and done CoolSculpting, but you're still drinking a lot of Diet Coke, sorry, for lack of better words, which your body is like, neurotoxic material, collect it, right? And so what's happening is your fat cells are collecting all of that diet pop, and now what you got is this one area, right, where there are no fat cells and it's flattened out, but everything around that area has now got a lot of increased volume. So it's really causing, aesthetically speaking, like a very dysmorphic look in the body, which is another thing that we've been seeing more and more of, that people are coming in like, hey, can we tackle this? Like, I have no more fat cells here. I've got all these fat cells around this. Like, what can we do about it? Which is why red light, why there is no destroying the tissue. We understand the value of why that cell shrinking down to the size of a raisin and leaving the shell intact is so important.
Okay, so one of the sounds like the biggest key difference is CoolSculpting destroys the fat cell, which can cause kind of dysmorphia around where the CoolSculpting was done.
That's right.
Versus red light, which initially expands the fat cells, the contents leak out, and then ultimately, over a series of sessions, the fat cells shrink. So instead of destroying the fat cells, we're shrinking the fat cells, which leads to reduction of inches.
That's
and
right.
ultimately weight loss. But it's also producing collagen and elastin production, which then tightens the skin as the fat cells are getting decreased.
That's right.
Inside, I've got some follow-up questions. So inside CoolSculpting, do you see, because typically when people lose a lot of weight, we'll see sagging skin. How does that look with CoolSculpting?
It does tighten, like with most of the cases I've seen, those areas, they remain pretty also tight.
Okay.
Mm-hmm.
And then walk me through CoolSculpting versus
Therapy, right.
Yeah. What's the difference?
So cryotherapy, as far as for fat loss and weight loss, the thought behind that is if you cool down the body in extreme temperature, then your body, in order to regulate your temperature, it's almost a thermogenesis type of an effect, which means that we're trying to warm up after we've been exposed to extreme cold, and that in turn should burn fat. And actually there's more research on burning brown fat, but that's the whole idea behind it. So again, we're not getting, just like in CoolSculpting or cryo, you're still not getting that offload. You're not getting that holistic approach in offloading toxins. You're not offloading triglycerides. You're not offloading cholesterol.
Yeah, and I know from doing cold plunges, like you're not going to target a certain area. With cryo,
Right.
it's an overall reduction, and then, I hope that an increase in brown fat would increase, which reduces other types of fat. So that's, okay, got it. So very different applications.
Very different applications,
Not
yes.
similar at all. Okay, and then, so let's talk about downtime. So most people, let's say they've had CoolSculpting or they're looking at CoolSculpting, what are they probably not thinking about that they should be asking
Sure.
or questioning?
Okay, so downtime's good, but overall time, right? So from the moment that you have that procedure done, it can take up to 6 months to actually see the result of that, because that's how long it actually takes the body to break things down and try to move it along once those are crystallized. So
Is it normally one session or a series of sessions?
it's one session per area, right? Per area. So one session per area.
Okay. So compared to red light, it's fewer sessions.
Way fewer sessions.
But much longer time to potentially see the results.
That's right.
Because in red light therapy, we're doing pre and post scans.
That's right.
And within immediately to 24 to 48 hours later, we're seeing inch reduction in those in areas that we have put the red light on.
That's right. I also have a lot of people coming in who have done CoolSculpting, and they want to know if they can use it as a complement to their CoolSculpting to actually get the best results from their CoolSculpting. And we have partnered with people in that and also have seen pretty incredible results. It does reduce the risk of what we were talking about too. So just helping that body lymphatically drain. Yes. Please.
Okay, so how else can we support that?
How else can we support outside? Oh, well, I mean, of course, understanding how that lymphatic system shunts itself into the liver, making sure that we are taking every precaution we can to actually support our liver through that, which is going to be, what's that going to come down to? It's going to come down to clean eating, right? It's going to come down to sometimes supplementation to support the lymph system and the liver and all your elimination pathways.
So people who are getting CoolSculpting, is there typically a motivation to also make lifestyle changes? I mean,
Not typically.
like what's the,
Yeah.
like most of the places or facilities that they're going to is just, let's just do the CoolSculpting
Yes.
and then, let us know if you
And I think that's why we're seeing so many people.
need it again.
Mm-hmm. Yep. And I think that's why we're seeing so many people, because they, if they've chosen to take that path, they have decided, okay, if I'm going to take this path and spend all that money, which it's, 2 to 3 to 4 times more expensive, than red light therapy is, they want to make sure that they're going to get the most out of their money.
Mm-hmm. So, walk me through how you're normally having that conversation with somebody when they come in, because there's a couple different types of people, right? Like, obviously, if they've already gotten CoolSculpting done and they're using red light as an adjunct to it, then great, they're ready to make some changes. They've already had CoolSculpting, or they're planning to get it in the midst of red lights. But the person who is considering both options, and we'll probably just do one or the other. How do you help them make that decision?
Definitely. So that scan usually, that's the decision maker. That first scan usually, when you can see that it's not just the abdomen. It's not just my inner thighs. It's not just, the back fat that I have, or whatever you want to call this little thing now that I have in my armpit. It's all over, right? So you can see all the aesthetic measurements on the scan begin to change, and realize that it's not just, spot reduction in one area or another area, but you are getting an overall aesthetic to that. And usually that's a huge game, that's the determining factor for people, because, they're going to spend $5,000 on their
multiple areas.
Right, exactly. And another one is the time, I think, because some people are like, I'm getting married in 3 months, or, I've got a trip planned for this, and they don't have that 6 month, to wait. And typically, like I said, yes, results right away, but I mean dramatic results twice a week over 8 weeks, right? And you're seeing that right away.
And to me, I'm always, there's not a quick fix to these things, right? And so to just get a procedure done but not address the lifestyle that got you to the point where you needed the procedure in the first place, I think is a huge disservice. That's one of my biggest concerns with the GLP-1s right now is, there's a ton of providers who are just making a killing off of prescriptions, and there's no lifestyle advice, there's no helping people understand what they need to do besides take the medication to minimize the detrimental effects of taking that medication. For sure, there's benefits and there's people who should be on them, but I think it should be against the law for these people to be on these medications and not have lifestyle factor and guidance and coaching involved.
I agree.
And I take the same stance with some of these other therapies, which is why, everything that we're doing in our office is really designed to, let's get to the root cause. Yes, we want to help somebody with body contouring, and yes, we want to tone and tighten and slim down, but the magic is the accountability, the coaching, the emotional and spiritual and mental aspect of walking somebody through a change like that.
Right.
And what led up to that, and the stress involved, the hormones involved, all those other factors. I think that's the biggest difference between how we approach this sort of technology in our practice, because we've already talked about, it's not what drives us crazy is just go lay on the red lights and you're going to be fixed, or, you're going to be slim down and trim. And it's the same thing with CoolSculpting, right? If you don't make the changes on top of, in addition to getting these procedures done, you're going to end up with the dysmorphic changes, and your risks go way up. So how do, a lot of people get CoolSculpting done. What do you think is happening with that? I mean, are they making just changes on their own then outside of that, or are a lot of them just having bad results?
I would say
after that, or
right. Yeah. I honestly, I would say that I see a pretty mixed bag of that. I have people who have gotten pretty good results in some of those areas. So I get to see it all. I tell people I get to see it all. I've seen really great work, and then I've seen really, really not great work, right? Really things that, like I said, that whole brick syndrome thing, you know, just being able to tackle it, but how rewarding it is to actually be able to get somebody on the other side of that. It's so rewarding, you know, to just see how happy they are with that. For the most part, by the time people come in, I think that they understand that there is something deeper and much more functional and nuanced to tackle. And I think that's what brings them into our office, right? Because you'll see people who have had CoolSculpting and they'll come in and they'll say, I don't know what's going on with me. I just keep gaining weight and it's not stopping, right? And CoolSculpting didn't solve that problem for them, right? But like you said,
because if there's a hormonal shift,
that's exactly
there's a stress shift, and your body's just
because
latching on to
exactly. And I want my women right now to hear me loud and clear, because I know I've sat with enough of you where doctors have come in and all they have offered is for you to actually move more and eat less, right? Put down the spoon. I have heard that come out of mouths of patients of mine who have been advised that by their doctors. So I do want to talk about this for a minute, because a lot of those women are honestly made to feel completely ashamed and distraught, and it provides no answer at all, right? And so when we say lifestyle, even lifestyle can only get us so far, right? Because if our hormones are hijacking everything, all bets are off. I will tell you that. It doesn't matter sometimes how well that you're eating. It doesn't matter how much you're exercising. As a matter of fact, that could be backfiring on you. And even the things that you were eating that were working before that aren't working now, that can be backfiring on you. And so when we even say lifestyle, but I almost want to say no, biochemical individuality. That's what I want to say.
Mm-hmm.
Not lifestyle, but hey, let's dial in right now to your biochemical individuality, because what's taking place in your body right now, hormonally speaking, is throwing everything off balance. So let's see what we can put back in place. Let's see what we can put back in balance. How can we bring balance? All of those things. Sorry, I get
No,
super
absolutely, yeah.
passionate.
And in no way am I referring
Oh
to
no,
like,
I know.
hey, just eat
Right.
less
Oh,
and
I know.
go get some
I
exercise.
just want them to understand after
100%.
hearing it over and over and over again, you know.
Yep, absolutely. And yes, that should be the main focus with whatever form of body contouring that somebody is
Yes.
getting.
Absolutely.
Like, you have to make those individual biochemical changes
Right?
based on where you're at in life and
Yes.
you know, all of the factors.
And even with red
It's not a
light,
one size fit all.
it's not. And even with red light, I will very honestly tell someone, listen, we can get you on the treatment, but unless we unhook, right, this specific loop that's taking place right now, like it's just going to be so much more. It's like swimming upstream, right? I would much rather go with the, you know, the rhythm, you know, and the force that's actually carrying me out. So we try to tap into that.
Mm-hmm. So, what's the biggest hesitation that people have when looking at either red light or CoolSculpting?
Mm-hmm. I think actually a lot of people will stand there and say, well, is this permanent? Is this permanent, right? And I actually turn around and say, nothing is permanent.
Mm-hmm.
Nothing is permanent. We're going to give you the tools. Here's the difference, is we're going to give you the tools that you need to, once all of that toxicity is liberated from your system, we're going to give you every tool that you need to keep the toxicity out of your system.
Got it. So, because permanent, it's almost the same as the biggest concern, like almost always on the paperwork when people are coming in, like, hey, what are you concerned about? It's gaining it back again because they've done other programs in the past, or they don't want to spend the time, energy, and money, and then it come back again. Is that kind of the same?
Yeah, absolutely. And I can speak to that as well because
I get the same questions inside of decompression therapy, right? Like,
yes.
Okay,
how long will this last?
We're gonna open up the discs and take the pressure off the nerves. Okay, well,
do I have to keep doing that for the rest of my life?
Yes.
Yes. Yes.
That's the real question.
It is a real question, right?
Yeah. So my response, I'm really interested in how you respond to that. But my response is, we want to get you moving and feeling better, but almost always there's going to be a need to be some kind of maintenance.
Absolutely.
You just like you should exercise.
Yes.
As part of a lifestyle, I think getting your nervous system and your spine and your body checked and stretched out. If I had a bulging disc, 100%, I'm going to be doing that on a regular basis so that I don't have to end up having surgery.
That's right.
And that is 100% in my mind worth it.
100%.
So now, just like with the other programs, right? Sometimes people choose to stay on and do a maintenance, and sometimes it's like, well, let me just see how I do, and I'll come back if I need it again. And I'm always like, we're here for you either way.
That's right.
So is it very similar?
Very similar. Here's the thing, is that just even living in our environment and breathing in and out the air that we're breathing in and out, right? And the food that we eat, I mean, and all of the right modifications, right? I always feel like there is a space to constantly, think about your body on a cellular level, on a regenerative level. I actually was talking to you today about this, like on a strictly a cellular turnover level, right? To continue supporting yourself in a way where you can mitochondrially offload, right? All of that garbage, right? Giving your body away, right? To facilitate, that constant cleaning up, right, of your body. I think that it's incredibly important, right? Just as I think, and to your point that, once we've accomplished in the beginning, that 20 to 30 pound weight loss, and we've retrained your body to metabolically feel safe, 20 to 30 pounds less, and then getting into a rhythm and a stride to actually, maintain your results. It's also that understanding of, wow, this is what I'm doing. This is what the red lights are doing, so I'm going to keep making sure that I'm putting good stuff in so I can keep turning over anew.
Mm-hmm. That's great. So, closing thoughts on, the people who are on the fence between CoolSculpting and red light, or, there's other forms of body contouring as well, but today we're focused on CoolSculpting versus body or red light therapy.
Yeah, get all the information you can, and ultimately, choose the path that feels most aligned for you. Really check in. Really check in. What is it that your body really needs? What is it that you really need? What are you trying to accomplish? That is what I would say. I would say, hey, like if you are feeling like, everything is in balance and I'm feeling pretty good, I mean, that's also gonna lend to your decision, but ultimately, it's your choice.
Mm-hmm. Awesome. So if you have any questions on red light therapy, how we do it in our office, we don't offer CoolSculpting, but we're happy to give you a body scan, and you can get an idea of where you're starting at if you're interested, and we can discuss how red light therapy works. Feel free to reach out to us. We're here to support you.